Good day, everyone. My name is Dakkshan. I am from group number 25, and today I'm going to demonstrate to you and explain to you how to feed a patient via nasogastric tube, gastrostomy, and jejunostomy. First of all, let's start with the nasogastric tube feeding. So, what is it? It is a medical process that involves the insertion of a plastic tube through the nose, past the throat, and down into the stomach. So it is usually indicated when there is a decompression of the stomach in the setting of the intestinal obstruction or ileus. But it can also be used to administer nutrition, medication, mostly for patients that are unable to tolerate oral intake. Procedure of the insertion of the nasogastric tube. First of all, you will need the patient to sit in an upright position with his neck slightly tilted. The next step is you have to estimate the proper depth of insertion by marking the tube with black marks. Then, you should lubricate the end of the nasogastric tube and gently insert the tip of the tube into the nose and slide it along the floor of the nasal cavity. Expect to feel a mild resistance as the tube passes through the posterior nasopharynx. Ask the patient to take sips of water through the straw, and also why we should do this is because it facilitates the passage into the esophagus. You can assess proper tube placement by asking the patient to speak. If there is a disruption in his voice, it means that it has wrongly been placed and you should remove it immediately. Next, to determine the position of the tube in the stomach, you should inject 20 to 30 ml of water and listen to it with a stethoscope at under the left subcostal region. This will help you determine the position of the tube in the stomach. Once this is done, you can start feeding the patient. Now, I'll explain about gastrostomy. What is gastrostomy? Gastrostomy is actually the construction of an artificial opening from the stomach through the abdominal wall, permitting the intake of food with a gastrostomy tube. Now, when is it used? It is usually used when there are birth defects of the mouth, esophagus, or the stomach, or either that. It can also be used when there are problems with sucking or swallowing, for example, in patients debilitated by stroke or dementia. Procedure of gastrostomy feeding. First of all, you have to ensure that the patient is sitting in a half-sitting position. After that, you will have to insert the syringe into the open end of the feeding tube. Pour the formula into the syringe until it is half full and unclamp the tube. The position of the syringe shouldn't be too high compared to the incision, as you need to slowly feed the patient. If it is too high, the food may enter too fast into the patient and may cause complications. And lastly, I will talk about jejunostomy. Now, what is jejunostomy? Jejunostomy is a surgical creation of an opening through the skin at the front of the abdomen at the wall of the jejunum. Okay, so what are the indications for jejunostomy? It is usually when the oral route cannot be accessed for nutrition, and when nasoantral access is impossible when the time duration of artificial nutrition is more than 6 weeks. And it is also as an additional procedure after major gastrointestinal surgeries with prolonged recovery time. Procedure of jejunostomy. First of all, you'll have to open the clamp and let the formula fill the entire tubing, clearing any air. Then you will close the clamp. Then you will connect the feeding bag tubing to the pump. Adjust the settings on the pump. Following that step, using the syringe, flush the J tube with the prescribed amount of water. Then connect the tubing of the feeding bag to the J tube, open the clamp, and start the pump.